I am a breast cancer survivor and monitoring every year for the past 6 years. I am BRCA1 positive. What are my risks of ovarian cancer or any other cancer? This is from Wendy.
Okay, Wendy, BRCA1. I'm glad you know at least you can prevent any more events happening. But it is the one that increases the risk of breast cancer pretty high incidence. So these women, when they find out, they are recommended to have both breasts preventively removed. Obviously, if there is an area of cancer, that breast gets removed, but the contralateral breast, it is recommended to preventively remove it because the risk of having another cancer in the breast is very high. Ovarian cancer risk really varies amongst, sometimes families who get ovarian cancer from BRCA tend to have it, something we call the penetrance of the gene. The gene can occur, but how it manifests in certain families varies. It varies between 20% all the way to 50 or 60% risk of ovarian cancer. But BRCA1 is the one that causes a lot more breast and ovarian cancer than other genetic conditions in breast. The percentages are pretty high, and we do recommend those women to undergo preventative surgeries. Most recently, we also recommend removing the uterus because endometrial cancer is also a risk in these women, and but the typical age of endometrial or ovarian cancer is later than the occurrence of breast cancer. So if a young woman still is interested in having children and still in childbearing age, we could monitor closely and with ultrasounds, with blood work, with physical exams regularly, and then allow for time to complete childbearing if a woman needs to have another child or still have her first child. So those things can be discussed, and it doesn't have to be an urgency to remove the ovaries immediately if there is a need or an urge to have another child. So because traditionally ovarian cancers, if they will happen, they happen about a decade, at least a decade later than breasts at least. So it's an older person's cancer than breast cancer with BRCA gene. Other cancers, melanoma, but there's screenings. We recommend skin screenings by dermatologists regularly in these women, but the most common ones: breast, ovarian, uterine melanoma. And that's it. You can't remove everything else. You can't change all the parts. We can change the ones that we can live without.
Yeah, no, interesting insight.